You have seen many recall videos on the internet and YouTube, but how is this recall different? Because this has all 200 questions recall. Approximately, I got 198 or 199 questions. And the best thing is, it is arranged subject wise, so you will know the subject wise weightage in the INICET May 2026. I have done meta-analysis of all the recall videos. As you know that meta-analysis is more authentic, and I have taken your reviews also after that. So this is most authentic, I can say. As a whole, no recall is authentic because it is very much difficult for you guys to recall the exact questions and the exact options. And also, we are not sure regarding few answers. So let's start the recall. Do subscribe to my channel if you are new to my channel, because if we complete 100 subscribers, then I will provide this PDF in my Telegram channel. The link is given in the description box below and pinned comment section. First thing is follicular cell FNSE, hemithyroidectomy. You do AST, colon cancer grading. I am just telling the answers. 50% involvement, it is the grade 3. Typhicogram, both the answers were 2 centimeter, 2 centimeter. Esophagus histology was given. It is was a image based question, and it is present in my digital image bank also. You can check that. The link is given in the description box below and pinned comment section. How to differentiate between small intestinal obstruction and paralytic ileus? It is the colicky pain. GCS score was 9, and image based questions were given. It was a bit easy only for the cleft lip, cleft palate. Obstruct jaundice plus palpable non-tender gallbladder curvature law, periampullary carcinoma, that is the head of pancreas carcinoma. Total mesorectal excision, this is a PYQ. You do sharp dissection. Order, so catastrophic bleeding control. At first you will have to control the bleeding, then airway, then circulation, then disability. When to give prophylactic antibiotic? 1 hour prior to the surgery. Mesenteric ischemia vignette was given, so CT angiogram is to be done and multiple option correct. Pain out of proportion will be the correct answer. Gleason score, it was the total was 8 and group 4, very high risk group. It is important to examine superficial lymph node in all scrotal swellings, yes, but test is trained to para and pre-aortic lymph nodes. So the reason is wrong. Assertion correct, reason wrong. Risk factor for cecal volvulus, previous surgery. Early blood transfusion in hemorrhagic shock is beneficial. Reason is improves O2 supply. So assertion is correct, reason is also correct, and it is the correct explanation of the assertion. Sphincter preserving surgeries are all except fistulectomy. Refeeding syndrome, this, if you have better options, you can comment me in the comment section. So most important is hypophosphatemia because it can cause rhabdomyolysis and it can cause cardiac arrhythmias. Pediatrics, regression of milestones seen with Rett syndrome. In our year of INICET, trofinetide drug for Rett syndrome was asked. Prolonged jaundice, down hypothyroidism, cerebral palsy. Kawasaki, not seen, purulent conjunctivitis. Neonatal hypoglycemia, asymptomatic, so breastfeed the baby. 20-month-old child, he is not able to obey the command, so you need to do a detailed hearing evaluation. Incomplete penetration, alternate generations are affected, that will be the correct statement. Differential cyanosis, PDA, multiple option correct. I searched it and it will be Listeria. Staph aureus will not be in the answer because it affects after 1 month of age. Haemophilus influenza and Streptococcus pneumonia. Central cyanosis, it is seen in pulmonary arteriovenous shunt. Match the following was there. It was an easy one. You can see this. The PDF will be in my Telegram channel. Monochorionic diamniotic twin. So diamniotic cord entanglement cannot be seen. It was also an image based question and it was also present in my digital image bank. Amenorrhea, absent uterus, normal breasts, sparse hair, androgen insensitivity syndrome. 17 hydroxy deficiency, so there will be increased pregnenolone, low cortisol, low testosterone, increased aldosterone. Shoulder dystocia, you give suprapubic pressure. HPV multiple option correct. 9 to 14 years is the target age group. It is recommended by both WHO and national guidelines. 90% coverage. These three statements will be the correct. Green vaginal discharge with pruritus, trichomonas. Post forceps, pain, fluctuant swelling, vulval hematoma. Pulse index, you all know. Probable signs of pregnancy, multiple option correct. Hager's, Braxton Hicks, and Goodell sign. Progesterone causes increased respiratory drive in pregnancy. Best method to prevent preeclampsia and history was given, so start aspirin from 12 weeks. In exogenous testosterone, there will be central suppression. Effects will be low FSH and LH. In PSM ecological study was the answer. In alcoholic of 10 countries versus cirrhosis, odds ratio was 6. Propagated epidemic, the answer is measles. uh, Population attributable risk PPV was coming to be 64.2, RMNCH plus A. So children receiving healthcare less than 20% is the red category. Components of attitude multiple option correct, behavioral, cognitive and affective. Influenza vaccine efficacy 90% and effectiveness 85%. So this was a common sense based question. Efficacy is ideal clinical trial and effectiveness is a real life scenario. In nested case control trial, we can predict odds ratio and we get the incidence from cohort, reasoning and assertion based question. So I will have to see this, and after seeing this, I will send the PDF in your Telegram channel. Heterogeneity in meta-analysis evaluates variation included between two studies. So I am also doing meta-analysis. This is the same kind of thing. Physiology, right coronary versus left coronary, it was an easy one. Filterability curve, it was an previous year question, image based question, so it is also included in my digital image bank. Pacinian corpuscle image based question, it is also included in my digital image bank. This time image based questions were a bit less and more of multiple option correct questions, some of reasoning assertion based questions. Match the followings were easy. Increase in glomerular capillary permeability leads to which substance in urine? Protein. Parkinson tremor is seen due to inhibition of globus pallidus internus. Hyperpolarization seen in visual. Where can neurons regenerate and increase in number? New question, dentate gyrus. ECG, and it is present in my digital image bank. Inferior wall MI, the source is right coronary artery block. Resmetirom, it is present in my recent FDA approved drugs list. So THR beta receptor. COPD, CHF difference. This also I will have to see a bit, and I will send the PDF in your Telegram channel. Meningitis, it was cryptococcal meningitis. Anti-Ro causes neonatal lupus erythematosus. ECG image based question, AFib, also present in my digital image bank. You can check from pinned comment section and description box below. Not a cause of fall in elderly. Hearing impairment. Frailty is affected by sarcopenia in the elderly. Respiratory alkalosis, this was also easy. Which have distinct treatment? Wilson's disease. Heart deformity seen with telangiectasia, there is facial erythema. So mitral stenosis is the answer. Renin is secreted response to reduced renal perfusion, and this was a case of temporal lobe epilepsy. So focal impairment of consciousness and temporal semology. Hypercalcemia due to malignancy, next best step is IV fluids. After that you give diuretics, bisphosphonates, salbutamol inhalation and all. If it was sequence based question, in that sequence you will have to arrange. TB meningitis, you see hydrocephalus. Secondary hyperparathyroidism with the clinical scenario. After confirmation DMS, next step is ACTH level evaluation. Lethal triad, hyperkalemia kalemia, coagulopathy, hypothermia, and hypocalcemia. Chronic inflammation, which type of amyloid? AA. X means bulky disease in Hodgkin's lymphoma, more than one third. PSG and subepithelial humps, which does not involve medium vessels. The microscopic polyangiitis is the correct answer. Many recalls have given it wrong that which vasculitis involves the medium vessel. It was which does not involve the medium vessels. The answer is microscopic polyangiitis because microscopic, that means microscopic vessels it is affecting. In my histology, it is present in my digital image bank. It was directly from Robbins, 1 to 3 days. Papain, 3 fragments, pepsin, 2 fragments, and mercaptoethanol, 4 fragments. It breaks the antibody. Liver fibrosis, Mason's trichrome, image based question was there. Thalassemia major, multiple correct. Defective erythrogenesis, suppressed hepcidin, iron overload. Iron deficiency anemia was the clinical scenario based on. Amyloid deposition, it is seen in Alzheimer's disease. Oncogene, so you can check the answer. Anemia, and what was the stain given to see the reticulocytes and Heinz bodies? So it is new methylene blue or supravital staining. Pharmacology, ticagrelol, reversible inhibitor, lamotrigine. I think only hepatotoxicity was the answer. If it was multiple, then GT means dizziness can also be included. Lamotrigine useful for GTCS. Therapeutic dose or index 4. First order kinetics, image based question. It is also present in my digital image bank. Ligand gated ion channel, H2. Rapid nitrogen tolerance, vasodilation tolerance. Clinidipine does not cause reflex tachy because it inhibits N type. Nicotinic replacement therapy, 15 minutes gap after acidic food. GS-GPCR, beta adrenergic. Match, you can check this. Anti-aging drug also match, you can check this. Fenfluramine monitors CVS fibrosis. ORS SGLT2 is the receptor. It is working through this channel. You all know that. ESBL carbapenems can be used, plasmid transmitted, and piperacillin and tazobactam can be used. One question regarding stimulant purgative was there. If you know the options, do let me know in the comment section below. Anatomy, hand-eye coordination, parietal lobe, emotional, cingulate gyrus, it was easy. Intercalated discs, multiple option correct. Only the zona occludens is not seen, rest all are seen. Histology, it was an image based question and it is also present in my digital image bank. Sublingual gland, external oblique muscle modification, so it is inguinal ligament. And match something was there regarding ileum and colon, it was also easy. Tail gust cyst is the remnant. Multiple option correct. Sensory decussion, so dorsal, motor, hypoglossal, and spinal trigeminal. Match the following. Origin, it was also easy. Foreign body in right bronchus because it is straight in the line and 3 lobes on the right side. If it is multiple, or if it is not multiple, then it is wider and straight in line. Biochem, high triglyceride in all except A beta lipoproteinemia. UV damage causes pyrimidine dimers. Glycosylation repair, deaminated cytosine. Uncoupler, multiple option correct. Decrease ATP, increase oxygen consumption, increase heat. GLUT4, very easy. Muscle. CRISPR Cas9, image based question, it is also present in my digital image bank. Patient with seizure, microcephaly, very long chain fatty acid. Transamination reaction required thiamine, pyridoxine, NAD, and FAD. Reasoning assertion question was there. Reason and assertion both were correct, and the reason is the correct explanation. Match the following was also easy regarding amino acids. Multiple option corrects, all the options were correct. Primers in DNA is given by primase. Formalin fixed, so it will be IHC. Reducing sugar, Benedict negative. Sucrose. Dephosphorylated state, multiple correct. Glycogen synthase, PFK2. Reasoning assertion based question, reason and assertion both were correct, and reason was the correct explanation. Match the following: safflower oil, edible oil, it was given, and the rest of the matching was also easy. If you know the other options, do let me know in the comment section. Pretomanate BPAL regime is being introduced, so it was important. Mycolic acid synthesis inhibitor. Two circular DNA in genome, it was difficult. Vibrio. Hookworm, skin penetration. Bacillus anthrax inhibit phagocytosis, so it will be the capsule. EF2 inhibitor, diphtheria toxin. Histoplasmosis, it was a previous year question of NEET PG, it was given in this year INICET. Mucormycosis not given. Voriconazole, it is also a previous year topic. Image based question was Entamoeba histolytica. Match the following, you can check it. Splenectomy done in Streptococcus pneumoniae. The septic arthritis was sensitive to oxacillin and cefotoxin, so cloxacillin you can give. Concentration dependent killing, aminoglycosides. Toxic shock syndrome, the correct option was MHC class 2 beta 1, and with the TCR it binds laterally. TB sputum, you give NaOH and NaCl. Nasopharyngeal carcinoma, it is caused by EBV, not CMV, so it is the incorrect match. Autoclave, incorrect. Prions are not destroyed in sterilization. Diabetic patient with black eschar, black thing because it is angioinvasive, so rhizopus. ENT, eustachian tube was shown. Tensor villi will be the answer. Posterior cricoarytenoid, you all know it is the abductor of vocal cords. Central nystagmus, wrong, is fatigability, not a multiple option correct question. Sudden SNHL, only you give systemic steroids because there is nerve edema. You will have to counteract the nerve edema, and many of the times the cause of the nerve edema is the viral infections. So you can give acyclovir also, but it is the second step. Main step is systemic steroids. Glasgow prognostic score, I think this question is wrong and you should email to the INICET because I searched manywhere, and Glasgow prognostic score, it usually consists of CRP and ESR. I couldn't get anything out of this, so I think this question is wrong itself. Merkel cell Rosenthal syndrome, not seen is proptosis. You see facial edema or eye edema, you see the facial palsy, and you see fissured tongue. Tumor in superior meatus, epistaxis, bony erosion, not likely diagnosis. Antroconal polyp is benign. Ophthalmology was complete out of the box. Uh, Trabecular meshwork, multiple correct. Uvoscleral meshwork, pericanalicular meshwork, and uveal meshwork. Dark room, multiple correct. Mydriasis and retinal and opsins change to photopsin. Increased sensitivity to light. This was attemptable. Match the following. This will be the answer. I have no idea, and you will also have no idea. I know. Power of accommodation. The nearest option was 14 diopter, but the answer was coming somehow maybe 16. But if 16 was there, it will be the answer. If 14 was there, I think it will be the answer. RAPD with painful ophthalmoplegia, you will see sudden loss of vision. Anesthesia, 3 questions. Halothane, multiple option correct. Cardiac output low, 20 to 30 millimeter of mercury drop, proportional to the depth of anesthesia. Malignant hypothermia stem was given, it is repeated. And the structures pierced by lumbar puncture, it is also given in my digital image bank, it was also repeated. Orthopedics, so London sign, after seeing multiple recalls, I think it will be external fixation of tibia, not asking the orthopedic surgeon, because usually those answers or the options are wrong. Using means asking a senior what to do next. These are usually wrong. So I am going with external fixation of tibia. Neuropraxia, physiological block. Image was of malunion of tibia. Clinical finding, Thompson test positive. Compartment syndrome, previous year question. Next step, fasciotomy. Radiology, toxoplasma, it is also present in my digital image bank. Acute flank pain without abdominal distension, you do radiological Investigation followed by CT. Right iliac fossa pain. USG was given. It is also present in my digital image bank. Next step is surgery. ACR gadolinium based contrast. So all the options will be correct in multiple option correct question. 12-year URTI. No radiological investigation is needed. Match the following, you can see it was easy. 70-year-old, history of pulmonary TB, ATT with back pain. What is the next step is biopsy to see the resistance. Dermatology, neurofibromatosis type 1. The image is given in my digital image bank. Match the following, you can check it. Cerebriform tongue, it is seen in pemphigus vegetans. It can also be seen in cases of vitamin deficiency. Black pigmentation of heel. Next investigation is biopsy, because the acral melanoma is the most common site of melanoma in the Indian population. Painful vesicles over penile region. Vesicles are there and it is painful with fever and malaise, so it is herpes simplex virus. 2 days neonate, so it will be pemphigus due to transplacental spread from the maternal antibodies. It usually resolves with time. Treatment required, and tinea capitis was probably shown. It depends. If it was a psoriasis, then colta shampoo or steroids or methotrexate can be used. But if it was tinea capitis, then oral antifungals. Now some of you are asking that how oral antifungals act on the hair. So they are excreted by the sebum, they are excreted by the sweat, and they are concentrated in the keratinized tissue. Cresofulvin has more tendency to be concentrated in the keratinized tissues. So that's why oral antifungals can act in case of tinea capitis. Actually, griseofulvin is the drug of choice. Benefit of non-treponemal test is response to treatment. If the titer of VDRL decreases by 1/4 or 4 times decrease in VDRL titer, then it is adequate treatment. Infant with itchy erythematous vesicles, it is called acropustulosis of infancy, and the most common cause is scabies. Scabies will be the answer. Novel antidepressant villadozone approved in 2011. Depressed man and divorced, not urged to live, so you will hospitalize, not just antidepressants. Korsakoff, you see anterograde amnesia. Classical conditioning, conditioned stimulus produced a conditioned response. Gunshot image was given. It is also present in my digital image bank. You can check it. And if you are going to purchase the digital image bank, go for the digital image bank pro, because it has more 200 to 300 images with the recent exam images also are given. So distant wound, sparrow foot you see in motor vehicle accident. Blast injury, burn in chest and face, quaternary injury. Match the following was easy, you can check. Afghani with condoms filled with drugs, it will be body packing syndrome, not body stuffing. I searched it on the internet. Stab injury, image based question was given. It is also present in my digital image bank, you can check it. And 16 years old girl raped by neighbor comes with 16 weeks of pregnancy. What not to include in management? Take consent from parents, you take consent from the victim itself. OP poisoning, which drug reverses ACE inhibitor activity was asked. Pralidoxim. Tattoo image, which layer it is settled? Dermis, you do Nd:YAG 1064 nanometer for black tattoos removal. Opioid antidote, naloxone. Respiratory depression not seen with strychnine. Oxym, image based question was given, and it binds to stereotic strike. Now you can see a video on how is NEET PG different from INICET. You need to watch this video, because if you are preparing for NEET PG. All the best for your future, guys.